All right, and now let's move on to the remainder of our first session on landscape and framing. At this point, we will begin taking audience questions, and you'll be able to ask a question by going to the link on the website that says join the conversation at hai.stanford.edu. I'd next like to welcome our speaker, Nigam Shah. Nigam Shah is a professor of biomedical data science at Stanford University. Nigam, you can share your screen and slides now. Welcome.
Thank you. So this is a story that is spanning multiple departments. I'm just a messenger here. This is the work of over 60, 70 colleagues who got on the same page at this URL below. And it's Stanford internal. So if you're a Stanford person, you can access it. It is not a public document, but I'm going to walk you through the highlights. And this is sort of our take as an academic medical center to see what we can do to help respond to this pandemic. So if you can go to the next slide. So the overview is that in such a situation, there are multiple kinds of information needs. So the first bucket is operational planning. And there we might need to know things such as, how many patients do we expect in our region? How many floor beds are we going to need? How many ICU beds? How long will our PPE last? The second bucket is clinical care decisions. We just heard that testing had been limited. Who do we test? Can the presenting symptoms help us screen people better? And then the last bucket is these broader research questions that drive the science. What are the drugs that might alter clinical outcomes? What are the characteristics of the virus of the patients worldwide? And all of these are efforts that several of our faculty are already engaged in. And let's walk through the first couple of them. So if we go to the next slide, here there should be a blue box with the information sources that are available to us. These would be sources from the region, such as the county public health department, the census breakdown, and then institutional sources from our testing facilities and so on, because we were amongst the few places that started testing very soon. These sources give us estimates of the growth rate and the disease burden in our neighborhood, and some internal signals about how often is a test coming positive, what is the rate at which we're admitting people. And then if we go ahead, that feeds into three different kinds of modeling efforts that help us plan hospital bed and resource use, that allow us to project county level information, and also estimate policy impacts. All of this then feeds into our resource planning, which is geared around planning our surge beds, modeling our protective equipment usage, and then also partnering with our county. And as one of our county officers put it beautifully, can we think of the county as one large hospital? And I think that's the right sentiment to plan with. And then lastly, that as we're doing all of this modeling, we also learn some clinical insights, such as, for example, the co-infection rates with other respiratory viruses is high. And as a result of that, it is not okay to test for, say, influenza, and based on that, rule out COVID. What I want to now focus on is that there's two kinds of models that are going around that most of you probably heard of by now. There are these things called SEER simulations or epidemic simulations that capture the dynamics of the epidemic. These tell us the impact of the policy interventions that help us answer when can we get out of these shelter-in-place situations. And we need 10, 12 diverse inputs for these, which are all practically guesses at this point. Then there are these simple calculators that tell us about the next few days. These take very few inputs, cases, hospitalizations, bed capacities, and then help us plan for the next 5 days, so to speak. So here's a screenshot of an epidemic simulator. This is from the OpenAI group. And the point here is there's many such things out there that give you this beautiful epidemic curve, but what we need is accurate inputs. And I love this quote from 538 that says, think of making these models like making a pie. But then if your recipe says, add 3 to 15 chopped apple steaks or Brussels sprouts, depending on what you have, well, that's going to result in a differently tasting pie. And it's a good way to think about these complex models that despite everybody's best efforts, we don't yet have accurate inputs. And so what we started doing is to say, can we focus on getting the accurate inputs? So here's a plot from the Santa Clara County of the number of cases and hospitalizations. And typically what happens is you would start with this blue dot, a case estimate, in this case as of March 16. You would then guess how many infected people are there in the county. Based on that guess, you would project how many will need a hospital bed, and then that gets you your number. But because there's uncertainty in these estimates, these numbers could vary between 1,500 to about 380. I'm just going to do a back and forth. Now that's about a 5-fold difference. And that's highly uncertain. You can't plan a hospital with that level of uncertainty. So we said, well, we're also tracking hospitalizations. Can we not just use that same series to project where the next dot is going to be? That's where this question mark is flashing back and forth. And so that's what we started doing. And the URL below will walk you through our planning around that. But our suggestion is use hospitalization data from your local region for the health system. You'll be much better off in your capacity planning. And then remember this 12 to 14-day lag between interventions like staying at home and then peak demand for hospitalizations. And day-to-day variation can be misleading, and we got to be watchful about that one number trends down doesn't mean that we're out of the woods yet. But California has been amongst the most forward-looking and amazingly efficient in responding to this situation. So in order to help other people use this kind of hospitalization data, as well as share our planning about our own hospital and so on, and to use it for others, we released these calculators. The URL is on screen right now. There's one that helps you do hospital bed and resource use projection. And then the second one allows you to do your county level or regional hospitalization predictions. The red box shows you that you can use confirmed cases or hospitalizations as inputs. The person highlighted here, David Shankar, is sort of the person who led this large team to get all of this done on a very short notice. So kudos to that team. And then I would just like to give you a flavor for the kinds of things we're monitoring as an institution. This is sort of our situational awareness. We're looking at the neighboring counties. We're looking at case rates, hospitalization. How are the ratio of new cases changing over time? How is the number of new cases changing over time? And all of this feeds into our modeling efforts that then informs our hospital and our neighboring counties and our peer hospitals that how should we think about the situation and be prepared. And then lastly, I'll zoom out a bit. So all of the things that I talked to you up till now were how are we responding to make sure that we're prepared. But at the same time, we do need to understand what's going on in the population. And another group of faculty, Eleni Linos and Julia Simard, are running the Stanford coronavirus study. And then Dr. Rusty Hoffman and Steve Goodman are running this daily health check, which is actually going to be launched very soon, I think today or tomorrow, so that we can monitor what is going on with people. How are they feeling symptom-wise? Are they getting testing? And then inform that larger geography information in our planning and response. So that's sort of the gist of the effort. And I'll end with this URL that if you have questions that you believe the Stanford data science team may be able to answer, please submit them here. This is a public URL. There's no guarantee that we can get to every question that you submit, but we will try our best. And I'll stop here.
Thanks so much, Professor Shah. For everyone listening, you get a good sense here of the ways in which an interdisciplinary approach, bringing all of the resources to bear of people who work within a university, can help inform this coronavirus response. So it's not just a matter of providing bedside healthcare with issues of masks and PPE and tests, but how data scientists can produce important models that will predict the path of the outbreak and how to provide a better response from within hospitals as well.